So I'm going to talk about, in fact, I'm just going to give a general talk about HCC, actually. That's what I'm going to talk about. So the structure is going to be to talk about staging and why it's relevant. I'm going to touch on surveillance briefly. I've got two sides on surgical treatment. Obviously, this is the RSM, not a surgical society. And I'll spend a little bit more detail talking about ablation therapies for HCC, then talking about local regional therapies in terms of chemoembolization and radioembolization. And then I'll touch very briefly on some of the chemotherapies which are being used and evolving strategies. So it's a very general talk about HCC in general. And really, I want to just start off with the BCLC classification, which is really the benchmark of everything we do in terms of our management at the MDT meetings for patients with HCC. And many of you will be familiar with this, with the stage from 0 to A, B, C, D, where D is very, very bad. C is less bad, but bad, bad, not so bad, quite good. So I think that's the way I'd probably classify it, really. So if you have BCLC stage 0, that's very early disease, small lesion, less than 2 centimeters. These patients can be managed with a resection, but actually an ablation might do them quite well, and they will have very good outcomes.